So I think the most important mission of ACEP is to promote the highest quality care for our patients. And what goes along with that is advocating for emergency physicians, and particularly our members, patients, and the public. What has come out in this crisis, and that we've always recognized, but I think now the public and governmental authorities are recognizing more, is how important we are as the front line of the healthcare system, and really the very important role we play in public health and responding to that. And so I'm passionate about the idea that we need to continue to promote that highest quality of care that we provide to our patients, and advocate that emergency physicians are the leaders in doing that in all venues, both within the emergency department and as the voice, often for the voiceless, when it comes to the healthcare system and access to care. I think the most important quality is being a good listener and being available to our members. One of the things that I've done as a candidate is to reach out, as I did with the Virginia chapter, to reach out early, to get the opportunity to speak with leaders and members within the chapter to understand what are their concerns. Our job as aspiring leaders within the college is to represent our members. And the only way we can do that is by being effective listeners. I've tried to go beyond that. I've done similar outreach to all of our section leaders as well. And my experience has been that a number of our section leaders were somewhat surprised to hear from a board candidate, which is a little bit unfortunate, because similar to the chapters, they're the front line of the work that all of us are doing. And so being a good listener and being available to our members is, I think, the most important quality that a board member can have. And from there, to follow through on the actions that our members expect of us in order to fulfill our mission. So I'm focused in running for the board, and what I've heard from our members is really in three specific areas, and they're both opportunities and challenges that I think come up. The first is that we need to take the lessons from this crisis and really advance the ball on the reimbursement debate, so that we're not just talking about balanced billing and down coding, which are of course important, but to proactively push for reimbursement for our role in capacity and readiness. So not just for the patients that we see, but for the patients that we're prepared to see. What Bruce and Tricia were talking about in terms of volume being very hit or miss should not be how we expect our reimbursement to move forward. And I'm concerned in terms of joining the board that as volumes come back, that all the goodwill that we've engendered as emergency physicians in this crisis may go away, and will again be in the same challenges when it comes to having a reimbursement model that allows us to fulfill our public health role. And as a crude example, police officers don't get paid less when crime goes down. Firefighters don't get paid less if arson goes down. We and EMS are the only frontline public health services that are dependent on volume. And there may be a component of that that needs to continue, but it can't be all that is the basis for this, and we need to take that lesson from this crisis. The second concern I have as a board member is one of the greatest joys I've had in being a chapter president and a chapter leader is that it's very easy to be engaged with our members, to communicate locally, and to understand all the issues that are facing them, whether it's in rural Pennsylvania or urban Pennsylvania and everything in between. I think as a board member, trying to represent the breadth of our membership, it's going to be very important to be engaged with the membership, and I'm trying to do that as a candidate and would continue to do that as a board member. I think one of the challenges we face and the opportunities we face as a college is that we're at a crossroads. We are a large organization, but our membership is stagnating in total. We are financially in a good position, but we are challenged for all the reasons that we're facing. We are onboarding a new executive director at the national level. And those are issues that I was privileged to lead teams in Pennsylvania in overcoming at a state level. And in fact, working with Bob Ramsey, Sarah, your predecessor in Virginia, he was a huge part of that in terms of our righting the ship here in Pennsylvania. And I hope to bring that experience to the board and really focus us on what our members expect of us and what we can do as an organization that no one else can do as well to inspire our members to continue their membership and to bring in new members. And to me, that's in the areas of advocacy. It's in the area of continuing education, really focused on what we need for our credentialing and our knowledge base, and also to focus on our newer members and our younger members to get them engaged and involved with ACEP early so that it's a habit for them to move forward. And then my last kind of area of focus is I think we face a serious ethical challenge from the crisis. Never before have we faced a situation where we are uncertain of our ability to protect ourselves, our team members, our family members, and our patients as we care for our patients. And for some of our colleagues, they had a complete mismatch in their ability to care for patients relative to the volume of patients they were seeing. Having served as our ethics committee chair within ACEP and worked on these areas my entire professional career, and as chapter president, having gotten our organization, our chapter represented on our state's crisis treatment standards panel, I hope to bring that skill set to the board as well. And I think that's both an opportunity and a challenge as we think about emergency medicine moving forward. And I think that what we need to focus on as leaders within ACEP is that our responsibility is to fight for physician leadership and for physician decision-making, especially when it comes to clinical autonomy, clinical decision-making, due process, and issues with contract transitions. The issue with private equity, I was in favor of that resolution because I think that we really need to understand what is the impact of the current financial model on how all of us practice. And it ultimately comes down to, do we as leaders within ACEP, are we focused on our members and making sure that they are leading the ability to deliver emergency care? And it raises a story that I think exemplifies what I would hope to bring to the board, is that we as ACEP leaders need to be focused on our members and never either give a thought or impressions that we are driven by our employers. And here in Pennsylvania, we allow integrated delivery networks where insurance companies can own health systems. And Highmark Blue Cross actually owns my health system, Allegheny Health Network, where I've practiced for 13 years. The two biggest fights when I was chapter president were with Highmark Blue Cross on insurance downcoding and balance billing. I didn't shy away from those fights. I didn't temper my concern or my leadership in those fights, and I put together the team that successfully fought those battles against Highmark Blue Cross because I was focused completely on the needs of our members and the needs of emergency physicians, because that's what I had sworn to do as a leader. So I think ACEP's role is to fight for physicians, to fight for physician leadership, and to fight for how do we deliver the best care to patients through physician leadership. And if we have a reimbursement model that is not solely focused on the volume of patients we see, then a lot of the economic factors that I think you're alluding to, Tricia, will be far more better addressed than they are now, because that's a symptom of a broken reimbursement system that doesn't recognize the public health role that we play. So one of the things that we've done as a chapter that I think has been very important to our success as a chapter has been an emphasis on building a diverse pipeline of leaders within our chapter from the ground up. A few years ago, during my time on the Pennsylvania board, we codified that reflecting the diversity of our chapter in all its forms was a bylaws mandated factor in terms of how we develop leaders in the chapter. And that led us to look at every level of our membership and leadership from the ground up, that we needed to reflect not just the demographic diversity in our chapter, but also the practice and the geographic diversity in our chapter. And so I'm very proud that that has been something that we have seen the results of being effective in our chapter. Among our committee chairs, half are women, half are men. Both our leadership fellows are women. In our board candidates this past year, half were women, half were men. Community practice, urban practice, academic practice. And where it really came home to me was in the fight on balanced billing. We as a state have a big urban-rural divide in Pennsylvania, and having a diverse leadership allowed us to more effectively engage at a grassroots level with our members, to be able to engage with legislators in rural and urban parts of the state, and to message why this issue was important. So it's not just a matter of patting ourselves on the back, it's that having a diverse pipeline of leaders allowed us to be more effective advocates for all of our members. So my experience as a chapter leader is that much of the work that goes on in terms of either advocacy, in terms of member engagement, in terms of continuing education actually happens at the chapter level. And one of the frustrations I had as a chapter president is that I found ACEP at a national level to be responsive, but not well structured to really help me understand where I needed to go to either get the information I needed or to draw on the resources I needed. So I think we as a board need to be very responsive to the chapters, and I include chapter executives in that as well. From bringing on a new chapter executive in my chapter, it was really important that she was well plugged in with national ACEP. But ultimately, the chapter is the front-facing face of our organization to the vast majority of our members, and that's something that we need to support, and that I would always try and keep my eye on as a board member. It's a great question. I have found, just anecdotally at least, that our opponents often pick on our smaller chapters as a way to try and set a precedent for bad legislation, such as on balanced billing, and that they hope that the lack of resources in a smaller chapter may impact and allow them to get their way. On the flip side, I think our smaller chapters are also the ones who are most engaged and most effective in advocacy in many cases, because it is a smaller community and their role is highlighted that much more as being on the front line of public health. During my time as Pennsylvania chapter president, we developed a relationship with the Delaware chapter where we talked to each other, supported each other in our advocacy. A lot of the Delaware chapter members are constituents of legislators in southeastern Pennsylvania and really helped us in our advocacy on balanced billing. And we helped them in terms of member engagement and inviting them to events so that we could keep that communication forward. So, I mean, ultimately, we need the whole orchestra to play together for us to be effective. So whether it's large chapters, small chapters, urban, rural, you name it, we need all the parts to play together to be effective. It's a really important question, and I think it's going to be ultimately driven by what is the value that we provide to members that they can't get elsewhere. I think we are going to need to be far more cost effective as an organization. Our members, especially in these economic lean times, are not going to tolerate large increases in member dues, and that creates a challenge for everybody at both the chapter level and the national level. I think we need to look at everything we do and say, what is the member value that's being provided and how can we deliver this most cost effectively? I think that another thing that is going to be important in looking at changes for our members is we're going to need to go to more programming that is driven locally as opposed to just our national scientific assembly. Whether that's national supporting more regional events in order to engage with members where they are as opposed to everybody congregating in scientific assembly. I don't think scientific assembly is ever going to go away, but I think that it's going to change both for cost reasons and for what our members expect in terms of engagement. And I think lastly, our advocacy agenda is probably going to be much more active than it's been in the past, in that we are going to need to be engaged both at a federal level and at the state and even local level. So not only on the legislative side, but on the regulatory side. We've seen this with the balanced billing fight, where we think we get good legislation and then the regulatory structure turns out to be adverse. And from talking to members in the Virginia chapter, I think you guys had a great piece of balanced billing legislation, but I heard that the insurance companies snuck something in at the last minute that might allow, later down coding. And that's an example of where national needs to help the chapter in those regulatory fights as well, so that the good work that's been done isn't affected. So more granular advocacy, looking at our offerings to members, scientific assembly, and being very cost effective is probably the three things that I see our organization having to deal with. Well, as a new board member, I think my first job is to listen and not to go in and crash as an elephant and say, I know the answer and you guys have all not known what you're talking about. I think it's going to be a matter of, if I'm privileged enough to be elected, to listen to our members and to bring that voice to the board as we look at every stage of this. I think that the crisis hasn't created new challenges, it's crystallized and revealed them. And I think that'll give a significant urgency to addressing all of these issues at the board level. But I don't want to promise you that in my first year on the board, all of a sudden these changes will be implemented, because I think that's unrealistic and is probably overly arrogant, to say the least. I hope that as a board member, that by the time my board service is done, that our members have said that ACEP is working for them and is working for our patients, and that the emergency care delivery system is better than it ever has been before, and that our role in society has been recognized as it should be at every level, and how it has been in this crisis and shouldn't go away. So if I get to the end of my board service and our members can say that, then I think that I'll have done a good job as a board member. Well, first of all, congratulations on your 50th anniversary. I saw that on the website, so that's great. I think, we're entering our 50th anniversary in 2021 as a Pennsylvania chapter, and, I'd love to hear the plans that you have. And then more than anything else, I'd love the opportunity to hear from you. What are the issues that you think we should be focused on as candidates? Because elections are about the constituents. They're about the people who are voting. They're not about the candidates, except for the fact of, can the candidates do what the electorate thinks that they need to do as leaders? So I think my two questions are, congratulations, and what are you guys doing in your 50th anniversary, and what do you think I should be thinking about as a board candidate?
Tricia, do you want to speak to that last question first?
I'm a relatively new grad. Relatively, I feel like I'm getting older rapidly. But what I'm hearing from my peers and from a lot of my new hires is a lot of fear. They're coming out into a really different job market than 10 or 20 years ago. They're coming out with more debt than 10 or 20 years ago. And I think they're feeling forced to either take jobs with companies that maybe they don't agree with entirely the way things are practiced, or practice in an environment where they don't feel safe, either because of the productivity demands on them or lack of PP, or, fill in the blank with any number of things that if you log into Facebook and listen to the angry people on EM Docs, you can see in the posts. And I think that if ACEP doesn't move to addressing some of those issues, they're going to lose that younger generation's engagement. A lot of my peers already are not members in ACEP, and I try to convince them why they should be, but I can already feel that disconnect and that feeling that it's this old guard that doesn't understand what this generation is struggling with. And so I think that ACEP really needs to address those issues and speak on those issues if they're going to engage that younger group that you were speaking about when you were talking about engagement.
No, I completely agree. I had an opportunity to talk with the chair of the Young Physicians section, and he specifically said that. I think one of the areas where ACEP needs to be very careful and is probably not doing the right thing is this issue of workforce and the issue of the role of mid-level providers. I'm concerned from having read that report that it doesn't reflect the exact concerns you were just mentioning, Tricia, of mid-level providers being perceived as substitutes for board-eligible and board-certified emergency physicians. Much of that is driven by the lack of data, that ACEP is not robustly collecting data to understand that. And one of the skills that I hope to bring to the board is I'm a clinical researcher in addition to being a practicing emergency physician. And I sometimes think there's a divide between the advocacy side and the data and analytics side within ACEP. And advocacy without data is simply ideology. And so when it comes to this issue of mid-level providers, my research group has produced data that we're presenting in June that shows that mid-level providers really provide no economies of scale and only marginally improve the productivity of emergency physicians. So they may have a role, but it's as an adjunct to us. I hope that ACEP will take that data, and certainly as a board member, I would be emphatic in saying that they should, to address one of the issues you're bringing up, Tricia, is that if we're not addressing the concerns of our younger members, then we're not going to have a future as an organization. And so when it comes to debt and how that relates to support in the current crisis, when it comes to the role of profit in our practice and how it drives how we move forward, and also the issue of workforce, I think those are all, really important issues. And it all comes back to, do we have the data and do we have the will to have effective advocacy and messaging to make it that we're the leaders on these issues for all of our members?